everyone. Welcome to the 5th episode of the PUSO to PUSO podcast, where you invite healthcare professionals to answer your pre-health questions. I'm one of your hosts, Michelle Nguyen, pronoun she, her, hers.
I'm your second host, Kara Oroville, pronoun she, her, hers. And this podcast is a project by PUSO's Lambda intern class. And today is actually a bittersweet day because this is our last podcast of the year.
Hi everyone, I'm your third host, Ali Punsalan, pronoun she, her, hers, and I hope that you all are enjoying learning about different healthcare professions, and be sure to check out our past episodes. Today is really special because we have a PUSO alum named Francesca, so if you'd like to introduce yourself, go ahead.
Hi everyone, my name is Francesca Lamotan. My pronouns are she, her, hers. And as was mentioned, I am an alum of PUSO. I graduated from UCI in 2011 with a double major in public health policy and psych and social behavior.
All right, the first question we have is just why public health? Many of us in PUSO, including Ali, Kara, and I, are public health majors, and so we'd love to hear more about your educational background and how you got involved in public health.
Sure. So growing up, I didn't really know about public health. I didn't really learn about it until college. So I guess to start when I was a little girl, I remember in school one time, our teacher had us get these papers that said, what do you want to be when you grow up? And to write in what you wanted to be and to draw a picture of it. And I wrote, I wanted to be a waitress. So I just literally wanted to serve and help others. I didn't have big aspirations. I didn't want to be an astronaut or a doctor or a lawyer or something that I think a lot of other kids might think of. I thought of something really simple and I guess more humble just because I wanted to help people. And I didn't become a waitress ever, but I think I just still found a way to give back to the community and help others, and public health ended up being how I got there. But I didn't get there immediately, as I said. So when I started school at UCI, I started as a bio-sci major because I thought I wanted to be a neonatal nurse practitioner. So I was really specific in what I thought I wanted to do, but it just didn't really work out for me. I didn't have the kind of passion and I think skills I needed to be a neonatal nurse practitioner. I really struggled with my bio classes, unfortunately. And I'm also a bit squeamish when it comes to blood and surgery and those kinds of things. And so I know I really tried to force myself to get there, to get to this profession I thought I wanted to do, but it just wasn't a good fit. And so I opened up about this with some other people in PUSO actually during this time when I was struggling, and I got a suggestion to look into public health. So I did that. I researched more about it. I learned about it, and I just really liked what it stood for in the mission. So focusing on prevention and stopping health problems before they happen. I really like that, and focusing on the community as well. There's really a big social justice aspect to public health too, I think. And I really like that part too. And focusing on those who are most vulnerable and serving others in that way. So I ended up switching majors halfway through my time at UCI. So I switched to a double major to public health policy and psych and social behavior, as I mentioned earlier. So that's what I ended up graduating with. And then I later got my MPH, my Master of Public Health degree at UC Berkeley. So that's a bit about my public health journey.
Yeah, I just want to go up and say that's really amazing and really inspirational to I know a lot of people who are kind of going through that where they first go into college. I know I went through something super similar where I was oh, I want to be a nurse, and I was public health sciences and I thought that I wanted to go into nursing after and then wanted to go into PA, and I even wanted to be neonatal like you. And I think me switching to policy where my strengths were really amplified, such as writing and critical thinking and learning about sociology and you said social justice issues. I think that it's really important for us to find our strengths, and it's a really great opportunity too in college to have that I said, opportunity to find what we're really passionate about. And I'm really glad that you were able to find that and you're able to do such great work with it too.
Thank you. Yeah, I think it's really okay to think about what you really want to do while you're going through college and to switch majors if that's what feels right and what feels best after doing like self-reflection or exploring, as you said. And I agree, like public health's a career where you can really use your creativity and critical thinking skills to like problem solve. And public health has so many different areas. You could do like nutrition, you can do sexual health, there's mental health. So there's just so much that I feel like it can apply to almost everyone, probably if you're just wanting to have that kind of a career.
Yeah, so it kind of like leads into our next question. So we heard that you're a founder, you are the founder of the Bay Area Public Health and a board member of the Filipino Mental Health Initiative in San Mateo County. Can you tell us more about what inspired you to incorporate Filipino culture into public health and the overall mission of those organizations?
Sure. So I think I'll start with the Filipino culture and public health part. So as I was thinking about going into public health and I decided to pursue it, I felt like there isn't a big support for public health in the Filipino community necessarily. I think growing up, you hear a lot about adults maybe encouraging you to go into the medical field, like maybe be a doctor or a nurse or a pharmacist. You don't really hear adults say, why don't you go be a public health professional? Or have you thought about being a health educator or an epidemiologist? So I think I'd like to be more of a role model for the Filipino community and like young Filipino Americans who might not have considered this kind of career. And also just show like it is possible for Filipinos to do this too. And just to have that representation. I think some people might be getting pushback from their families or friends if they're not going into the medical field or something that's more known or something that they're more used to in their families or their social circles. I think that there are a lot of public health issues that connect to the Filipino community too that could be addressed by public health professionals. For example, like we have a lot of delicious Filipino food, but it's not always the healthiest. There's a lot of fried food, sugary foods, high saturated fat foods. Like they're so good and I love them. But if we have that kind of diet like every day, it's not always the best for us and it could lead to serious health problems. So helping to address that like through a public health lens could be helpful. And then I think there's also like still a smoking and vaping culture among Filipinos. And then also mental health, like mental health still has some stigma, I think, in the Filipino community where maybe it's not as encouraged to seek treatment because people might think you're crazy, is how sometimes people put it, even though that's not really an appropriate term. People with mental health problems shouldn't be thought of as crazy and just like trying to hide behind smiles, like acting like everything's okay in our culture when really you might not feel okay and it's okay to seek help and to open up about that. So those are some of the reasons like why I'm interested in public health as a Filipino and just trying to bridge those two areas where I have my culture and then this career and passion for a profession of mine. And you were asking also about Filipino Mental Health Initiative in San Mateo County. So that is a group that I'm a part of, and our goal is to really improve the well-being of Filipinos in San Mateo County. We do that by providing resources to the community that are culturally relevant, connecting them to different mental health services and programs, and really working to reduce the stigma of mental health. And for anyone who might be interested in it, we do have a website, a Facebook, an Instagram. Our website's fmhi-smc.org. And we also actually have chapters in San Francisco and Solano County. So we have representation in other parts of the Bay Area. And maybe it will come to SoCal one day or Irvine. That would be really cool too. And then the other organization you brought up was Bay Area Public Health. So that's a new project that I actually just launched last month. It is a blog and social media project that aims to bridge different public health professionals across the Bay Area, and also those who are just interested in public health, maybe pursuing a career in public health in the future. So highlighting the stories of these people, their experiences, their passion, and just get us more connected, like learn about all the cool stuff happening in our neighboring communities. So that's really the reason for that. And that's also on social media, and there's a website for that too, bayareapublichealth.com. And happy to feature any of you if you live in the Bay Area and you're in public health too. I see some reactions. So yeah, feel free to connect later. Happy to have some PUSO representation on there too.
That sounds awesome. All of the projects that you're involved in are just like so cool. And I think you're really making an impact on the public health community, whether it's in the small community in the Bay Area to like a larger scale. But speaking of public health awareness and representation, it's been over a year since the COVID-19 pandemic started. And I think we can all agree that people are starting to recognize all of the amazing work that public health professionals do now more than ever. But we'd like to know if you could tell us more about how the pandemic has impacted your line of work and the projects that you're involved in.
Yeah, so the pandemic has really, really impacted my work. So I work at a county health department. And because I work at a health department, it means I'm a government employee. And what that means is I'm also a disaster service worker. So when you're a disaster service worker, that means if there's an emergency going on, like a wildfire or a pandemic, you can be called away from your normal work to work on those emergencies instead. And so that's something that happened to me last year. I had to be called away from my normal job at the time, which was to do tobacco prevention. And I ended up working in our county's emergency operations center, is what we call it. And in that job, I had to do things like schedule COVID testing for certain facilities like nursing homes, drug treatment centers, and other really vulnerable locations. I also got COVID test results and I reviewed those and prepared disclosures. So letting people know if they tested positive or negative, or if they needed to be retested because maybe there was an issue with their specimen. I also tracked data like ICU bed capacity and other hospital data and a lot of other things just related to COVID response. So that was a full-time job for me for a little bit, and that took me away from my normal job and team. So because of that, my team had to work without me. So that's more workload on them trying to cover for what I'd normally be doing. And then like all that tobacco prevention work was a little bit put on hold in some ways because of the pandemic too. So like normally we'd be working on different tobacco policies with different city councils. Because of the pandemic, they're like, okay, we need to focus on responding to that instead of protecting people from maybe secondhand smoke or tobacco products. So those issues were not addressed as they normally would be, like at the rate that we would hope. And there was also an increase in smoking in some places during that time too, because people are stressed from the pandemic. So they might go back to smoking if they quit before. And since people were sheltering at home too, they were smoking more in their home is what we found. And we get more complaints about people experiencing smoke from their neighbors if they lived in like an apartment or a condo or a townhome. So those were issues that were going up, but our staff wasn't as available to help respond to that. So that was really tough. And our team is still impacted today. Like we're not complete. I'm back in my normal role, but there are others who are still deployed to COVID response. So we're still like taking on a lot more work than we normally would be. And then I'm still doing also some COVID work, but not as part of our emergency operations center. So there needs to be more community education about the pandemic now that it's happened. So I'm doing part of that. I'm helping to lead a COVID-19 education campaign for young people called Crushing the Curve. It's a Bay Area regional campaign. And so we have a youth council that works on social media messaging and a website. And then we just help to make sure that they're guided and we're providing assistance with that. So that's one project. And then also our health department, social media messaging, I'm also involved in that. So putting out messages about vaccine clinics now, messages about mental health, taking care of that, other things they need to know about the pandemic. It's always changing. And our health department, we've been part of the process from the very beginning because the health department just has a huge role in responding. Like we have a health officer who puts out the health orders, like when we had to go in shelter in place last year earlier in March time. So we put that out, our health officer did that. And then we are now doing the vaccine clinic. So it's every step of this pandemic process we've been involved in, and staff are pulled to help do communications around that and just to do program planning around it too. And part of this work also made us all go to telework. So that was a change too, rather than working in an office. But I don't mind that. I like working from home actually. But I've still also done some COVID work on the ground too, aside from when I was in the Emergency Operations Center. Like, for example, as part of that Crushing the Curve campaign, we had mask pouches that were created so people could put their mask somewhere, like say they go do outdoor dining or you're going doing errands. They have somewhere to keep their mask when they don't need to be actively wearing it. So went and delivered those to different community-based organizations to give out in the community, and then also to a mask mobile. So we have like a van that drives around and delivers things that are needed to the community related to the pandemic too, to help reach those who are most in need and need the most support. So I've been helping with things like that. And then I think emotionally, like our teams have just been really affected by the pandemic too, because a lot of people have suffered like grief and loss during this time, including some coworkers who've lost family members due to COVID. So it's really sad and it's tough to keep hearing those kinds of stories. And I think one thing that I've done to help address that is in our workplace, we use Microsoft Teams. So it's this program to chat with each other, send messages. And I created a channel on there where we could send like messages of positivity and gratitude. So just a way to help have some light and hope and inspiration for each other to get through those tough times. And staff have really shown appreciation for that. So I think it just shows like we are having a tough time and we need to find ways to support each other because public health professionals are really impacted right now. So yeah, we have been playing a huge role throughout this pandemic. I think it's good that there is more recognition of public health now. There probably could still be some more recognition. I know there's a lot of like applause and gratitude for frontliners who are like the doctors and the nurses, which is so deserved. They are doing so much hard work and good work that we need. I think there's a lot of public health work being done behind the scenes too, though that's not always recognized. So I think it would be great if there was more like public health funding that could be given out in the future, because a lot of those resources tend to go to medical care and treatment. But it's definitely been a learning experience and the pandemic's not over yet, so we're going to keep working at it.
So first of all, thank you so much for sharing your experience and for all the work that you've showed us that you do. And I definitely do agree that people are always applauding the frontliners, but it's kind of hard to put faces to like who's doing work behind the scenes and who's actually doing the non-medical side of things and actually preventing the pandemic on a more public health scale. So thank you so much again. Kind of switching gears, since you are a PUSO alum, so we just wanted to know, what's your favorite PUSO memory?
There's so many good PUSO memories. It's like one of the best experiences of college being in PUSO. So I was on the board and I was co-publicity my first year and then co-secretary my second year. So it's a little backwards because you'd think you'd start out as a general member and then maybe join board, but there were openings from the beginning. So I just went in and tried it. And then I decided I'll be a general member the last 2 years, see what that's like, and do other things in college that I wanted to pursue and spend less time in a leadership position in PUSO. But I'd say the experiences on board were some of my favorite. I think like it's hard to pick just one. If I was thinking about some of my favorite things, it might not necessarily be due to board, but I really liked PUSO B. I was a part of that. So I don't know if any of you are in PUSO B or if that's still going on because you're all virtual. Michelle, okay, cool.
Yeah, our future director, Megan, she like choreographs for PUSO B and it's really fun.
Awesome. Yeah, I was like a co-choreographer for 1 year. It was kind of like a side choreographer. I don't know if I'd call it there was a main person. I was like an assistant. I wasn't as good, but it was fun. Doesn't matter if you're good or not for PUSO Beat. We're not competitive like the other dance groups on campus for sure. So love that. And I feel like just the general meetings and the after events, those are just like simple times where you're bonding with other members are really great and fun. And then I'd say Med Mission Gala is also a really fun experience too. Hopefully you all can experience that at some point, like in person, and in a ballroom is where we've had it before, or like an outside venue from campus. And it's I think it's fun to dress up and just see all the effort you put on as a board to make that event a reality and to give the scholarship and to just go through that is really rewarding.
Honestly, hearing your experiences is so amazing because personally, as a first year, I really didn't get that PUSO in-person experience yet. So I'm super excited. And also, I just got elected to be one of the co-pus for this year, and Ali's our MedMish coordinator. So we're excited to hopefully follow in your guys' footsteps. You kind of already talked about this, but can you recall your experience on board? Like, how was it being on board when you were still at UCI?
So I remember there were a lot of board meetings, but they were always fun. Like it never felt like I didn't want to be at the board meeting. I think board, you get super close with the other board members because you spend so much time with each other working on the different projects and activities. There's also board retreat where or at least we would go to a location off campus and we would spend time like intensely working on our outline for the year and like different activities we would do. And then we would go have fun afterwards. So it's like a prize after like working so hard. So those are really good memories too. And I think it's just really important to work as a team when you're on board. You all have your different roles and like holding each other accountable, being open with each other. If you're having different challenges, like maybe you really need to focus on something at school in a class at the time, just letting your other board members know like, hey, I got to take a step back for a second because of this reason. And hopefully you'll all support each other in that way and help cover. And yeah, I just think like board is a great experience. I recommend it to everyone to try to be a board member at least once, at least see if you like it. I hope that you'll all continue being board members for like the rest of your years, unless there's something else you want to pursue, then that's fine too. But I think you'll really like it.
Yeah, so thank you so much. And like speaking of board and being on board, we just elected our new board for the 2021 to 2022 school year. And we were wondering if you have any advice you'd like to pass on to the new board members.
Sure. So some other advice I'd say is don't be afraid to suggest your ideas and to be creative. I think there aren't any bad ideas you could share that could only build onto possibly more ideas. Just brainstorm with each other, be supportive. You never know when something might spark like a new tradition or something really successful in PUSO. Like I was part of a class in PUSO or a year where we started the Spam Masubi fundraiser, and now that's still ongoing and it's like a big part of PUSO. And I know also that you still do that tradition. I saw in another podcast where you end the meetings with this, and that's still going on. Oh, for those people who are just listening, not on video, where you end the meetings with making the heart with your hands at the end and standing in a circle. So yeah, like just because it hasn't been done before, I don't think you don't have to like shy away from suggesting it, because maybe it will last for years and years, like those kinds of things. I think if you guys get stuck, you could also always turn to alums for any advice or suggestions. I like to think we're all really friendly and open to helping current PUSO members, PUSO board members. So don't be afraid to reach out. And if you don't like have contact information for a certain person or a profession, like I'm happy to help. You can contact me anytime. I know when I was also on board, like when I first started in my co-publicity position, I got a binder of like all these past PUSO pages and work that the co-publicity position did. I don't know if that's something still going on where you get like that historical information, but taking time to look through that, I think would be really helpful for whatever your board position is, so that you have that background and you can get ideas on where you might want to go next and take that. At our board meetings, we also had a binder that we each had as a board member with how we operate and where we could keep our notes and different board profiles for each other. So these profiles would have like our name and our contact info and some fun facts about each other too. And just things like what we wanted to do in the future, like where do we see ourselves in 10 years? And I know I still have those binders and like they're fun to look at from time to time, just to see like what our other board members used to think and like how we used to operate and how different are we now from what we said when we were in college. So I don't know if you're all still going to do that, but maybe you have virtual ones. But those would still be nice to keep up with, I think, if you're open to that. I think it could be really helpful. We'd have those binders with us at every board meeting, and it's just a good place to keep all your notes and documents. I think another advice is, this isn't something that I actually did, but it's something I do at work right now that I think you could apply to college, is keeping an accomplishment journal. So like every time you accomplish something, even if it doesn't seem that big, just like write it down in that journal, keep it up from time to time, and then you can use that to like update your resume later, or if you need to write an essay for an application for something, you have this accomplishment journal that you can turn to remind you of like all the amazing things that you did while on PUSO board. And I've still mentioned PUSO when I've been applying to things lately for my profession. So PUSO board is helpful, even though it might just seem like a college club. It can make a difference in your future career. For example, like I was applying to another board of directors recently, and they asked like, what other board experience do you have? And I wrote PUSO on there, even though it is just a college club, and I got accepted to the board. Not saying it was because of PUSO, but it could have played a part. And that board, by the way, just so you know, is the UC Berkeley Public Health Alumni Association Board of Directors. So I'll be starting my term in July for 3 years. So if anyone's interested in public health at Berkeley in the future, happy to talk about that too.
Oh my gosh, that sounds amazing. Congratulations, by the way. Thank you for sharing all of those ideas. I'm not really sure how the directors are planning to like do our meetings, but that really does sound like a really cute idea that we could implement into future board meetings. And I think it's just really nice to have like something sentimental to look back on. But overall, thank you so much for taking your time to speak with us about your career and about public health and all of your fun times in PUSO. You're honestly so inspiring, and we're so proud to have you as a PUSO alum. And yeah.
Thank you so much for inviting me. And I'm really happy to still be connected to PUSO, and I hope you all continue to like have a great time in the organization and just be welcoming to everyone who joins PUSO, because I think that's really a big part of it, showing that PUSO love and having that spirit and support for each other.
We'll definitely make sure to keep in contact with you, because as Michelle said, you're honestly so inspiring, and I think it would be really good for future PUSO members to kind of hear about the public health career path and know that it's a viable career. Like, it doesn't have to be nursing or medicine essentially. But make sure that you guys follow the PUSO to PUSO podcast on SoundCloud and check out the video version of this podcast on YouTube at youtube.com/pusoatuci. Also, make sure to check out Francesca's organizations, which we will link in the bio of the YouTube video.
And for the last time on the PUSO to PUSO podcast this year, we're going to do our famous PUSO closeout. So for those of you who do not know, we like to cross our hands and make little hearts with the neighbor next to us. And we have to do a dip, and then we say, and PUSO. So we're going to do it together. So with the new board, we're going to do 5, 6, 7, 8. And PUSO.